Hi, I'm Mark Peluso, Chief Health Officer and College Physician for Middlebury and the Monterey Institute. And today I'd like to briefly review the upcoming respiratory illness season and some new CDC recommendations on vaccines. The CDC is predicting a busy respiratory illness season this winter. We're going to look at that as well as some new COVID vaccine recommendations and where to get the COVID vaccine, flu vaccine recommendations for everyone over the age of 6 months, and the fact that if you're over 65, you may want a specific COVID vaccine that's designated for that age group. We'll also discuss that egg allergy is no longer a contraindication for flu vaccine and that we have some flu vaccines happening on our campuses. We'll talk about respiratory syncytial virus vaccine, which may be helpful for individuals over 6 years old, but it should involve a shared clinical decision-making session with your healthcare provider. As far as insurance coverage goes, the Cigna coverage is 100% for in-network pharmacies and in-network medical offices, and can be 100% in out-of-network medical offices. It depends on your level of coverage. We'll go into that a little bit in a little bit more detail. The CDC Bridge Access Program is available for folks who do not have insurance and need or want a COVID-19 vaccine, and we'll talk about that, how to get that. The CDC is predicting a similar cold and flu season in terms of hospitalizations to what we experienced last year. So if we look at this vertical axis, the weekly hospitalizations per 100,000, we can see that in the 2021-22 COVID-19 peak, it was somewhere in the mid-30s. Last year, it was in the low 20s when we had combined peaks of flu and RSV and COVID. And then prior to COVID, we would generally experience hospitalization rates just over 10 per 100,000. And this year, there's a couple different predictions. One is a scenario where the illnesses are only at moderate level for most folks, and that the peaks of when those illnesses are occurring are staggered. If you combine the peaks so they overlap, or if any of the illnesses are severe, we could end up with this scenario, which would be more like last year. We're not sure which it's going to be, like last year or this, or maybe lighter. The good news is the CDC is not predicting the kinds of hospitalizations we are seeing during peak Omicron. We can look at this a little differently by looking at the different illnesses and when they peaked in the last year. This is RSV. You can see it. This is a percent of total ER visits in the United States due to RSV. You can see this line here representing under 2% of ER visits due to RSV. It peaked in early November, late October, early November, and then tapered off, but was still present for part of the year. If we overlay COVID-19 on top of that, you'll see that the peak happened for COVID-19 in the United States happened in late December, early January, and we had another peak in late August. And the peaks did not necessarily overlap with RSV. If we roll influenza over that, the data shows in the United States that the peak for influenza occurred earlier, starting in mid to late October, peaking in early December, and then sort of by the time we hit late January, the influenza peak diminished. And we've seen second peaks for influenza, but we did not see that last year. But in prior years, we sometimes see two or more peaks as different influenza strains come through. If we look at the United States combined, you can see that 10% of ER visits were due to these three illnesses at the peak in late November, early December. And again, there was another little peak out here, mainly due to COVID, in all these illnesses combined. The California data shows a similar pattern. And it was largely due to the influenza. There was a little bit of a bump out here due to COVID, which was occurring in late December, early January. In Vermont, the data looks a little different. We had a broader COVID wave and a much higher peak of influenza that came and went. The peak was a little bit later in the year or later in the season compared to other areas of the United States, but our numbers of ER visits went up to as high as 14% for these respiratory illnesses. And when it occurred is important because we're in early to mid-October right now, and these peaks could be occurring in a similar fashion this year. So what can we do about it? Well, let's talk about some vaccines. The COVID-19 vaccine, the new one, is recommended for anyone over the age of 6 months. And this vaccine contains strains of COVID-19 that are much more common right now. Let's look at that. Let me explain that a little bit. If we look at these two diagrams, they show percentages of the strains across a timeline. So from January 2023 to July 23 in this upper diagram, you can see that the BA5 and BQ1 strains were predominant in the early part of 2023, but as we move through the year, XBB strains start to be more prominent. And if we shift this a little bit from March to August, we can see that here the XBB is the predominant strain, and now we're even seeing EG5 come in here. And the new vaccines protect more against these strains of COVID-19. So the CDC is recommending 1 dose of the updated 2023-2024 COVID-19 Pfizer or Moderna vaccine for anyone over the age of 5. And if you're over the age of 5 and you get 1 dose, you'll be considered up to date. There are a couple exceptions to that. If you're moderately or severely immunocompromised, you may need multiple doses. And if you're a child between 6 months and 4 years old, they may need multiple doses to mount an adequate immune response. I often get asked, well, if I've recently had COVID-19, should I get vaccinated? We know that vaccination, even after someone's had COVID-19, protects against severe illness. It adds additional protection. And you can certainly wait for 3 months after you get your COVID illness. So you can wait over 3 months after getting COVID to get your new vaccine because you've got protected antibodies. You've got circulating antibodies. However, if you want to get it sooner than 3 months, once your illness is completed, you can go ahead and get the vaccine. And that depends on your personal risk of severe disease, of the risk of disease in a close contact, someone you may be living with. And for some people, it may depend on local COVID-19 hospital admission levels. So if the admission levels are going up, they might decide they want to get COVID-19 sooner than the 3-month window is over. And other people may just want to make sure they're getting vaccinated with the most up-to-date strain in the vaccine. So those are all options for you. There are very few people that shouldn't get the vaccine inside that 3-month window, and that has to do with if they developed a severe COVID-19 illness. Where to get updated COVID-19 vaccines? The best place is vaccine.gov. The rollout of the vaccine this year is really to local pharmacies, healthcare provider offices, and state health offices. It's not to colleges, for example. So vaccines.gov can point you in the right direction. If you're in California, you can go to myturn.ca.gov for additional direction. In terms of insurance coverage, for all 3 vaccines, COVID, flu, or RSV, it's covered whether if you go to a pharmacy, this RX means pharmacy. If it's billed under the pharmacy benefit, it's covered 100% in network. If you go to a medical office and get the vaccine, it's covered 100% in and out of network for platinum level and gold level insurance plans. If you're in the silver insurance plan in a medical office, it's 100% in network and 70% out of network. The way I think about it is stay in network, whether it's medical or pharmacy, and you'll be covered at 100% for all 3 vaccines. To find out what pharmacies are in network, you can find this link and it will show you this graphic and give you that information. Another way to do it is to go to vaccines.gov and it will give you options of locations where the vaccine is available and allow you to sign up for appointments. And this is for COVID and for flu vaccine. Locations, if you do not have insurance, you can find locations that participate in the CDC Bridge Access Program by clicking here. When you enter your information at vaccines.gov, you'll get the option of finding locations that provide the Bridge Access Program, which will cover it if you do not have the Cigna Health Plan coverage. Let's talk about influenza vaccine. There's new information about the vaccine. The recommendation is that anyone over the age of 6 months that doesn't have a contraindication should get the vaccine. It used to be that individuals with an egg allergy needed either a certain type of vaccine or a certain clinic condition to get the vaccine in case they had an allergic reaction. And all that has been removed. And the Advisory Committee on Immunization Practices, or the CDC, and the FDA note that you do not need to worry about egg allergy to get a flu vaccine. I'll repeat that. You do not need to worry about egg allergy to get a flu vaccine. If you're over the age of 65 and you're looking for a flu vaccine, you might want to find a location that provides one of the 3 options designed for people over the age of 65. You can get any of the vaccines that are available, but there are 3 that are specifically designed for individuals over the age of 65 who might need a little bit more of a boost to mount an immune response. There's some good news coming from the Southern Hemisphere that tends to see influenza sooner than us in the Northern Hemisphere. And they found that in the Southern Hemisphere, people that had the flu vaccine had a 52% reduction in influenza-associated hospitalizations. That's a significant number. We also know that the circulating influenza viruses that are heading north continue to be similar to ones that we saw down in the south earlier in the year. So the current vaccines might offer similar protection to what the Southern Hemisphere folks experienced if these variants remain the same, and they could. So that's really good news. Flu clinics are going to happen on our campuses. On the Middlebury, Vermont campus, it's happening at no cost to employees. It requires you to make an appointment through online scheduling. It's being offered by Addison County Home Health and Hospice, and they're asking you to bring a completed influenza consent form. The vaccine that's available is for 18 to 64-year-olds or anyone over the age of 65 and up, but it won't be one of the specially designated 65 and over vaccines. These posters will be through midpoints. There's a QR code you can scan to get the influenza consent form, or you can click on a digital link if it comes out through an email to get that information. On the Monterey campus, there's an employee clinic on October 25th at the Holland Student Center. It's available at no cost. COVID boosters are not available at that clinic, and appointments are not required. The 65 and over vaccine will be available. You can scan the QR code or click on a digital link in the materials that are going to be sent out to you to get access to the required forms, which include a flu consent form and a flu voucher. These are specific to the Monterey Flu Clinic, and you need to bring those forms with you. For students in Vermont, there will be 3 flu clinics at no cost to students. You can self-schedule through the Student Health Portal or Pyramid, and you can also contact health services, but obviously the self-scheduling is preferred. I think these flu clinics are a great option, and they preserve appointments at health services for other types of visits. And I encourage students to go ahead and get a flu vaccine. Let's talk about the new respiratory syncytial virus, or RSV vaccine. It's recommended by the CDC for individuals 60 years and over. And that's because older adults can get very sick with RSV. It can account for up to 10,000 deaths a year, many hundreds of thousands of hospitalizations, and over 1 million medical encounters due to illness related to RSV. Folks with RSV that have underlying health conditions and are over the age of 65 have a much higher risk of being hospitalized due to RSV. The medical conditions include cardiovascular disease, chronic lung disease, diabetes, and all the other conditions listed on this slide. Many of the people that ended up in the hospital had 2 or more of those conditions. And so thinking about your health and any underlying illness and your age may help you decide whether or not you want this vaccine. The benefits of the vaccine include that it's a single dose only. It protects against lower respiratory tract disease, which can put you in the hospital. It's 80% effective in the first RSV season after vaccination and can last for up to 2 seasons. Now, this picture shows an older gentleman and a baby. RSV tends to cause problems causing hospitalizations in the really young and the more older folks, and they can give it to each other easily. And so there's vaccine for both, but just know that it's different. Your adults over the age of 60 are getting a vaccine designed for them, and that there are different strategies for babies that I won't go into. But the CDC is recommending that people over the age of 60 talk to their healthcare provider first to see if the vaccine is right for them. And that involves a shared clinical decision-making process where you talk about underlying risk factors, your age, possible side effects, and come to that decision together to see if RSV vaccine is right for you if you're over 60. The RSV vaccine side effects were generally mild. The most common one was injection site reactions. There were very rare cases of inflammatory neurologic events, and it's unclear if they would have just happened anyway or if they were related to the vaccine. And so there'll be more studies being done on that. But in general, the cases were so rare that it was deemed to be a safe vaccine to give to most individuals, especially people with high risk factors. When you think about giving the vaccine with other respiratory illness vaccines, such as flu or COVID vaccines, you can do that. It's okay to do. There just isn't a lot of data on whether the vaccines help boost immune responses or could cause more reaction to a particular vaccine. Specifically with influenza, there's limited data on that, and there's really no data with RSV plus this new COVID vaccine because they're brand new. That's something to discuss with your healthcare provider. In some cases, it may be completely appropriate to give RSV with influenza vaccine. There's a lot of factors to consider, such as your overall risk of illness, whether you're going to have an adverse reaction or have had adverse reactions to vaccines, a lot of side effects, what your patient preference is, et cetera. So in summary, CDC is predicting a busy respiratory illness season this winter, and we have 3 vaccine recommendations that will help us combat that the risk of severe disease. The new COVID vaccine is recommended for everyone over the age of 6 months, and vaccine.gov is the best way for you to find a location that has COVID vaccine for you, including Bridge Access Program vaccines. Flu vaccines recommended for everyone over 6 months old. Egg allergies are no longer a contraindication. If you're 65 and over, you may want to find a flu dose that's specific for people over the age of 65, but all vaccines are considered effective. The ones designed for people over the age of 65 may be a little more effective. Flu clinics will be happening on our campuses soon. Respiratory syncytial virus vaccine may be helpful for people over the age of 60, but you should have a shared clinical decision-making session with your healthcare provider. And when it comes to Cigna coverage for these, remember, in-network pharmacies and in-network medical offices are covered 100%. There's a CDC Bridge Access Program for people under the age of 65 without insurance. You can find those locations on vaccines.gov. That's the update. Thank you for your time, and I hope you all have a great winter and avoid getting too sick this year.